This case study is on an instance of new onset atrial flutter during a stress echo test. The patient was a 43-year-old Asian male who was 5'9" and 150 pounds. He had no previous personal cardiac history, but his father had previous coronary artery disease and hypertension. He completed a regular exercise stress test 1 year ago, completing 9 minutes and 38 seconds in the accelerated Bruce protocol, and this showed to be a normal test. During the pre-test of the stress echo done, the patient started with no symptoms and was in normal sinus rhythm. The patient also started with a normal blood pressure. During the exercise stage, the patient began to have premature atrial complexes, or PACs. As the test went on, the PACs became more frequent and were accompanied by couplets and triplets. Nearing the patient's target heart rate, short, irregular, narrow, complex runs started to occur, and shortly after the rhythm fully converted to atrial flutter with a variable block. The patient ended up completing 10 minutes in the accelerated Bruce protocol, reaching their target heart rate and having an appropriate blood pressure response. The patient's only symptom was just a feeling of a rapid heart rate. After the post-exercise ultrasound images were complete, the doctor instructed the patient on how to perform a Valsalva maneuver. This maneuver was unsuccessful for terminating the atrial flutter. Therefore, the doctor then gave the patient a carotid massage, which was successful in terminating the atrial flutter. At the end of the test, the doctor prescribed the patient anticoagulants to protect him from potential stroke. The patient was also given a 14-day Holter monitor to assess how often the flutter occurs. The patient was also scheduled for a follow-up with the hospital cardiologist after all testing is complete.
The Valsalva maneuver is a 4-phase breathing technique which helps diagnose problems with the autonomic nervous system. It restores normal heart rates if tachycardia is present. It may terminate paroxysmal supraventricular tachycardias. It cannot be used if a patient has high blood pressure or is at risk of heart attack. For phase 1, you blow air against your closed airway, bearing down, which will increase the chest and aortic pressure that forces the blood to the body. In phase 2, it causes a steady drop in blood pressure. This raises the heart rate and cardiac output. In phase 3, the body relaxes and blood pressure falls. In phase 4, blood rushes back to the heart and the heart rate returns to normal. A carotid massage is done by gently massaging the carotid artery for 5 seconds while monitoring blood pressure and the heart rhythm at the same time. This can clarify the type and mechanism of different rhythm disturbances present. It is a diagnostic tool for carotid sinus hypersensitivity, and it is also able to terminate SVTs. The major indication for a carotid massage is atrial fibrillation or atrial flutter. During the massage, it increases vagal tone. It is able to normalize bundle branch block. It is able to localize site of second degree type 1. It can evaluate sensing function for pacemakers. And it is a diagnostic tool for carotid sinus hypersensitivity. For contraindications of doing the carotid massage would be having diseased carotid arteries, history of heart attack or stroke in the last 3 months, history of ventricular tachycardia or ventricular fibrillation. For treatments of atrial flutter, there are options of medicine, electrical cardioversion, catheter ablation, or a pacemaker. Medications are used to slow the heart rate and relieve symptoms. Anticoagulants are used to rule out clotting, and antiarrhythmics are used to restore sinus rhythm. Cardioversion may be used to shock the rhythm back to normal. Catheter ablation is used if cardioversion does not work, and pacemakers are a last resort. Conclusions. The patient had been asymptomatic during pretest and became symptomatic during peak exercise. Atrial flutter occurred during peak exercise and was triggered by frequent PACs. The patient tried doing the Valsalva maneuver, which failed to convert atrial flutter into sinus rhythm. After doing a carotid massage, the atrial flutter was terminated. A Holter monitor is necessary to explore further treatment options, which may lead to medication changes, cardioversion, ablation, or permanent pacemaker. Here are some open-ended questions. What would be done differently if the patient was symptomatic? Which next steps would be used if the Valsalva maneuver and carotid massage did not work? What can atrial flutter progress into? Thanks for listening.